What is HIV/AIDS? HIV/AIDS is a disease caused by a virus called HIV. HIV attacks the body's defense system, making it hard to fight off infections. If HIV isn't treated, it can turn into AIDS, which is very serious. HIV spreads mainly through unprotected sex, sharing needles, or from a mother to her baby during childbirth or breastfeeding. There's no cure for HIV/AIDS, but medicines can help people live longer and healthier lives. To prevent HIV, people can use protection during sex, avoid sharing needles, and take medicines like PrEP or PEP if they're at risk. What are the symptoms of HIV/AIDS? Fever. Many people with HIV experience fever, often accompanied by chills or night sweats. Fatigue, persistent tiredness, or extreme exhaustion, even after adequate rest, can be a symptom of HIV/AIDS. Sore throat. A persistent sore throat or difficulty swallowing may occur, especially during the early stages of HIV infection. Swollen lymph nodes, particularly in the neck, groin, and armpits, may become enlarged or tender. Rash. HIV-related rashes can appear as red or brownish spots on the skin, often on the chest, face, hands, feet, or groin. Muscle and joint pain. HIV/AIDS can cause muscle aches and joint pain, which may be mild or severe. Headaches. Persistent or severe headaches can be a symptom of HIV infection, particularly during the early stages. Weight loss. Unexplained weight loss or a significant decrease in appetite may occur as HIV progresses. Thrush candidiasis, a fungal infection commonly known as thrush, can cause white patches in the mouth, throat, or esophagus. Night sweats. Profuse sweating, especially at night, can be a symptom of HIV/AIDS, particularly during advanced stages of the disease. It's important to note that not everyone with HIV will experience symptoms, and symptoms can vary widely among individuals. Additionally, many of these symptoms can also be caused by other conditions, so it's crucial to get tested for HIV if you suspect exposure or if you experience any concerning symptoms. What are the causes of HIV/AIDS? HIV/AIDS is caused by a virus called the human immunodeficiency virus, or HIV for short. This virus attacks the immune system, which is the body's defense against infections and diseases. When HIV damages the immune system enough, it can lead to AIDS, which stands for acquired immunodeficiency syndrome. HIV is mainly spread through certain body fluids like blood, semen, vaginal fluids, and breast milk. The most common ways HIV is transmitted are through unprotected sex, sharing needles or syringes with someone who has HIV, or from an HIV-positive mother to her baby during childbirth or breastfeeding. It's important to remember that HIV/AIDS cannot be transmitted through casual contact like hugging, kissing, sharing food or drinks, or using the same toilet or swimming pool as someone with HIV. How HIV/AIDS affects your body. HIV/AIDS weakens your body's defense system, making it hard to fight off infections. Here's how. HIV attacks a type of white blood cell called CD4 cells, which are important for fighting infections. As HIV destroys these cells, your immune system gets weaker. With a weakened immune system, you can get sick from infections that wouldn't normally be a problem. If HIV isn't treated, it can lead to AIDS, which makes you even more likely to get sick from infections or certain cancers. In short, HIV/AIDS makes it harder for your body to stay healthy and fight off sickness. How is HIV/AIDS treated, and what's included in the treatment plan? HIV/AIDS is treated with medicines and therapies. Medicines called antiretroviral drugs help control the virus and keep the immune system strong. They're taken every day. People at high risk of getting HIV can take a medicine called PrEP to prevent the virus. After potential exposure to HIV, another medicine called PEP can be taken within 72 hours to prevent infection. If someone with HIV gets sick from infections, they may need more medicines to treat those infections. Alongside medicines, counseling, healthy eating, and other support can also help manage HIV/AIDS and keep people healthy. By sticking to their treatment plan, people with HIV/AIDS can live long and healthy lives. Regular medical care is important for managing the virus. How is HIV/AIDS diagnosed? HIV/AIDS is diagnosed through a series of tests. These tests usually involve checking for the presence of HIV antibodies or the virus itself in a person's blood, saliva, or other bodily fluids. Additionally, healthcare providers may conduct physical examinations and ask about symptoms and risk factors for HIV/AIDS. If initial tests indicate a possible HIV infection, Further confirmatory tests may be conducted to ensure an accurate diagnosis.